When I think about comorbidity and bipolarity, I think about mental and medical comorbidities. And on the exam, the question will say, which mental disorder in the DSM-5 text revision has the highest rate of comorbidity? You circle bipolar disorder. And this reflects the complexity of the disturbance. It truly is a five-alarm fire. When we compare and contrast bipolar 1 and bipolar 2 disorder, looking at specifically the rate of comorbidity, what emerges is the story that bipolar 2 is worse off. You have a higher rate in bipolar 2 of anxiety disorders, ADHD, eating disorders like binge eating disorder, substance and alcohol. We also know when you look at personality disorders, more common in bipolar 2 than bipolar 1. Isn't that interesting? Now, I have an exam question I submitted for the medical students quite a few years ago. What is the most common neurologic disorder in bipolarity? And the answer is migraine headache. And migraine affects 20% of people with bipolar 1 and 40 to 60% of bipolar 2. We also have data now from our group and others that obesity and diabetes may be more common in BP2 than BP1.